Hi, I'm Jenny Back from the Public Affairs Department here at HHS, and welcome to our web chat on healthcare and the Affordable Care Act. For centuries, society has drawn a line between mind and body. Over the years, health experts have come to recognize that mental health is just as important as physical health, and that often the two are interrelated. Unfortunately, a disproportionate share of people with mental and substance abuse disorders are uninsured. Estimates show that somewhere between 1/5 to 1/3 of the uninsured population are people with these disorders. Today, our panel is going to talk about how the Affordable Care Act will help people with mental and substance use disorders receive the coverage they need and, more importantly, the coverage that they deserve. Joining us today is Secretary of Health and Human Services, Kathleen Sebelius, and Pam Hyde, who's the Administrator of the Substance Abuse and Mental Health Services Administration. Well, Pam, behavioral health and the passage of the Affordable Care Act. There's been a lot of talk about other areas, but it's really changed sort of the approach on behavioral health too. How has the passage of this law impacted what you do and sort of how you think about the programs that you are designing for folks?
You know, I think the behavioral health community has really been seen as kind of a separate issue. It hasn't been seen as part of health care. And that's true of both systems, and it's true of people who have those disorders. So the Affordable Care Act really offers us an opportunity to think about behavioral health in the context of health and to realize that it's just a part of health, and it's a part of health that has been ignored in some cases or been discriminated against in other cases, and that we really now have an opportunity for getting people coverage and getting people services and prevention efforts for people with behavioral health needs.
Are more people?
You know, Jenny, we saw a great example of this when the oil spill occurred, and we at HHS were asked to respond to the oil spill and looked at where the health needs were going to be the greatest. What we found out very quickly, and Pam and her team did a spectacular job on the field working with folks, is it was really folks who were either so stressed out because they had lost their jobs or were worried about the oil that was beginning to cover beaches. They didn't know what was going to happen next. We saw alcohol rates begin to go up. Domestic violence calls began to occur on a regular basis. So really, very quickly, the scientists discovered that the most significant health impact of the oil spill, short-term and unfortunately probably long-term, is in the behavioral health area. It has an immediate impact on folks, and it's clearly a part of restoring the health of the community, getting folks the help they need.
Has that sort of that same approach then is coming in emergency responses and healthcare and some of the other rules that you've passed earlier this year?
That's absolutely true, and I think everybody's beginning to understand that behavioral health, that you can't have a healthy America without having good behavioral health. And for example, about 25% of the admissions to hospitals have something to do with substance abuse or mental health disorder. About 2/3 of the antidepressants are actually prescribed in a primary care setting. And yet we know that people with serious mental illness have about 83% of them are either obese or overweight. And we also know that on average they die at about age 53. That's way too young. So what we know is there's health needs among people with behavioral health disorders, and there's behavioral health needs in the healthcare system that have not been adequately addressed. This act is really helping us do that better.
I want to just focus quickly because the Secretary was just actually at a meeting today, which was the very first meeting of the Prevention Council, which is called for in the Act. I know, Pam, SAMHSA does one of the best jobs inside HHS talking about prevention. Secretary, can you talk about how prevention is an important tool, and then, Pam, maybe more specifically in the behavioral health area?
We're really excited about the prevention aspects of behavioral health, especially in this act. The science behind behavioral health prevention is really there, and people haven't really understood that. The IOM put out a report about a year and a half ago that laid out that science and made it very clear that we can prevent substance abuse and mental health disorders among our young people and moving into adulthood. About half of the adult mental health issues start before the age of 14, and about 3/4 of them start before the age of 25. So if we can actually act on that prevention efforts, but by then we can really do something about adult mental health issues as well. There's activity in the Act, including the Prevention Council, that allows actually payment for prevention, some screening for brief intervention screening for alcohol, some depression screening, some behavioral health assessment for children. So there's a number of things that the Act is making possible for people that weren't there before. So we're really pleased about that. There's also some national education efforts that are going to go on about prevention, and we really want to see and will see behavioral health be a part of that.
And I know there's stuff coming in Medicare, right? And
Yes.
yeah.
Well, it's in the private insurance plans and in Medicare. And if you think about it, to take it out of the behavioral health world for a minute, certainly the right treatment for someone who had a heart attack at the right time is often a way to save a life and save dollars. Preventing that heart attack from happening in the first place is the real way to save the life and save the dollars. The mental health field is full of those examples. Rather than waiting until someone is in a crisis condition and has to be hospitalized, rather than waiting until they are in a situation where they need, multiple interventions, addressing it early, getting the preventive care, as Pam says, getting the screening to show if there's an early problem, and then hopefully the treatment with affordable coverage eligible to every American as part of the Affordable Care Act. We can move into a world where, not only will you be identified as having a need, but then that need can be addressed by having a health home, having a doctor intervening early on, and getting the kind of treatment that could prevent long-term acute illness.
Pam, I was just struck by something the Secretary said about getting more people involved. How are more people going to be covered now? I mean, we've talked about prevention and the preventative services in the Act. Another message that we talk about a lot on this program is getting more people covered. What kind of difference is the law going to make in terms of covering more people?
It's going to make a tremendous difference for people with behavioral health disorders. Of the 32 million people that we anticipate being covered, about 6 to 10 million of them we expect to have a substance abuse or mental disorder, an untreated illness, addiction that we can actually help. About 8 million people are currently served by our public behavioral health system, and most of them most of them currently are uninsured, and many of them are low income, so we think a whole lot of them are going to get coverage as the Act unfolds. And that's going to create a real opportunity to provide services they never had before, both preventive as well as interventions for this actual disorders.